The Nigeria Center for Disease Control, NCDC, says there is no shame in getting tested and seeking treatment for the coronavirus COVID-19 pandemic in the country. The head of Department Surveillance and Epidemiology Department, NCDC, Mrs. Elsie Ilori, said this in Abuja at the Joint Presidential Task Force briefing on COVID-19. Ilori said that in an effort to slow the infection in the country and for it to be effective, Nigerians must play their part as citizens to support efforts by the federal and state governments. Ilori said that the agency's strategy in the country was to promptly detect, isolate, and manage cases to recovery. She said that the truth about COVID-19 was that it affects anyone and everyone, urging Nigerians to adhere strictly to preventive measures.
If we are showing symptoms, get tested. If it is a loved one, encourage them to get tested. There's no shame in getting tested and seeking treatment. We must continue to take responsibility by using masks in public places, maintaining that physical distance from others, frequent hand washing, and other measures that we need to take. These are mainly the elderly or persons with existing health conditions, such as those with diabetes, and that may weaken their immune system. So that's why we need to take responsibility. Because even though we, as healthy people, are not showing symptoms, but there are some that are that have conditions that they might not survive it. So we need to take responsibility. So our strategy in the country is to promptly detect, isolate, and manage cases to recovery. However, this is not straightforward when there are a high number of asymptomatic cases who are not easy to detect, and they don't even know that they have it. The danger of this is the continuous and unintentional spread of the disease, particularly to vulnerable persons who may develop severe complications. In Nigeria, the age group with the highest cases of COVID are those between 31 and 40, and those are the active age group. But the age group with the highest fatality are 50 and above, and unfortunately, at least one person out of 10 of that age group might die. So when we ask that we take responsibility, it is beyond protecting ourselves, and it's also for us to protect our loved ones. We all know someone who is vulnerable, and it is beyond, and this could be our elderly parents or friends battling with one illness or the other.